Okay, good afternoon, everyone. And first, I would like to thank Ben and Richard organized this wonderful seminar. And then I'll bring you guys from the human world to the animal world. Okay, so first, if you haven't heard about oxytocin, I think in the past 1 hour, you will already know there's a very close relationship between the oxytocin and the social cognition. So we know in human studies, we already found oxytocin affect a wide range of social cognition. For example, perception and recognition and memory of the social stimuli, socially reinforced in learning, and complex social cognitive behaviors, including trust, cooperation, and empathy. So in these studies, as you already heard in this seminar, they mainly use the non-invasive approaches, such as the MEG, EEG, fMR, and also the TMS. So we know this method, they are very powerful and can tell us the function connectivity among the brain. However, there's some limitations because they are non-invasive. And so if we want to know more about oxytocin's effect, especially the neuronal and circuit mechanisms underlying the effects of the oxytocin, we need to include the animal models. So animal models are essential for us, not only for investigating the neural mechanisms underlying the effect of the oxytocin, but also for us to exploring oxytocin-based therapy strategy for individuals with dysfunctional social behavior. Then the problem is what kind of animal shall we use? We all know the oxytocin has been studied in rodents for many years, even before the human study. But shall we use rodents? Of course, it's very good animal models, and it helps us to understand a lot about the neural circuits about oxytocin. But we know rodents have very different social behavior compared to humans. So here, we would like to use animals is non-human primates. So we know non-human primates shares about 98% identity with humans, and especially has some very similar on the psychology, anatomy, and especially behavior parts. So non-human primates, especially rhesus macaque, may be an ideal model for us to study the effects of oxytocin. Today, a few studies have studied the effect of oxytocin in monkeys, especially in the behavior part. And consistent with human studies, these animal studies have also found intranasal administration of oxytocin will affect social behavior and cognition in monkeys, such as attention to face features and facial expressions and self-reinforcement learning. And however, it remains unclear how oxytocin will change the brain activities in monkeys. So here, we used fMR in awake and behavioral monkeys and investigate whether oxytocin will modulate fMR response evoked by the perception of facial expression. The perception of facial expression is a major effect has been studied in humans in the oxytocin world. So here's what we do. First, we like to define our eyes. We perform a localized study to locate the area response to face. So we present monkeys with face, object, and place in a block design. And then by contrasting face versus a blank screen, we found the face response voxels are widely distributed in many regions, including occipital cortex, temporal cortex, prefrontal cortex, LIP, and of course amygdala. Then we present monkeys with 4 different facial expressions, including the lip smack. We also call that a piercing, and also fair green, also called fearful face, and also threat face and a neutral face. So when we contrast emotional face versus neutral face, we found a similar map as the face response map, and just more limited. Then let's look at more details in these face response regions. So first, let's look at the amygdala. So in the amygdala, when we present these 4 different facial expressions, and we found relative to the neutral face here, and the fearful face and the lip smack face evoke stronger fMR response compared to the neutral face. but the threat phase shows no difference compared to the neutral phase. Then what will happen if we give the monkey oxytocin? So let's look at the neutral phase first. So you see, the oxytocin does not alter the response to the neutral phase, as well as the lip smack phase. Lip smack phase is a special for monkey. We usually don't have that for human. It's kind of happy or officiated phase. Then, but we found oxytocin changed the response to the fearful phase and the threat phase. And these two kind of phase is what we also called the negative phase. So that is oxytocin will change the response to the negative phase, but not neutral phase or relative positive phase. So we found this kind of phenomena not only in amygdala, but also in all the regions we found phase response. So include the occipital cortex from V1 to V4, and also the prefrontal cortex, including FEF, the LPFC, VLPFC, and OFC, and also, of course, the inferior temporal cortex, LIP. So, and in the previous talk, Rina already tells us there's some test the CSF concentration of the oxytocin. So in monkeys, we know so far the maximum time people have measured is up to 30 minutes after we give the monkey oxytocin. We still can find oxytocin increased concentration in CSF. And humans, so far the maximum measured is 18 minutes. And then we are wondering whether we can use fMR to find such kind of changes in the monkey's brain. So here's what we found. And so we found the fMR response to fearful phase and the threatened phase. Reduced response to these two kind of negative phase has been lasted till almost 2 hours after we give the monkey oxytocin administration. So that this kind of time window will help us to maximize the experimental and therapy context. And in the previous talks, people talking about function connectivity. And here, of course, we are also going to look at the function couplings among these phase response regions. So let's look at the function couplings among these regions during the placebo condition first. So during the placebo condition, and you can tell this image, the patterns looks very similar to each other. But among the coupling between the amygdala and the occipital cortex and temporal cortex, especially temporal cortex, you will notice there's increased function coupling during the monkey during the fearful and the threatened phase compared to the neutral and the lip smack phase. Then when we give the monkey oxytocin, you will find the similar coupling will change under the oxytocin effect. That is, oxytocin will reduce the function coupling between the amygdala and the occipital cortex and temporal cortex. So our previous study, when we use monkey as a model to study the amygdala effect, when we inject the abotanic acid to amygdala to cause a lesion there, we found amygdala will modulate the valence effect we found in the temporal lobe. That is, when we did the lesion in the amygdala in monkeys, the valence effect, that is emotional phase evokes stronger response to neutral phase, has been reduced by the amygdala lesion. So this is very similar to what we found here. So that indicates the function coupling here we found reduced function coupling. The direction mainly most likely is from amygdala to the occipital cortex and temporal cortex. So from these studies, and we found very similar result between our monkeys and the human studies. So our result indicated homologous between monkeys and humans in the neural circuits mediate the effects of oxytocin. So that is, we can use monkey as a model to explore the oxytocin study, such as develop the oxytocin-based pharmacology strategy for treating patients. And especially we can use invasive and more complicated pharmacology method in monkeys, such as we can infuse like oxytocin or other kind of the hormones directly into the regions we are interested in. So I would like to thank the people who helped me to finish this work, and also this work is funded by the NIMH, NCS, and NSFSC. And thank you for your attention.